Good afternoon, everyone. Myself, Dr. Vinod Kaushik, on the behalf of IIP India Digital Team, welcomes you all. I just showed my gratitude towards Dr. Sanjeev Keja, IIP President, and Dr. Ruchi Vaishnav, IIP Women's Health National Head, for providing us this wonderful platform for sharing the knowledge. Today, the webinar is organized by IIP Women's Health District Ghaziabad team, and the topic of the webinar is fitness training in a special population by Dr. Nikky Tyagi. And today, I know Dr. Monica Chandra, ma'am, is a moderator with Dr. Priyanka Tyagi. Now, I will just hand over to Dr. Monica Chandra. Please continue with this webinar. I just request everyone, please subscribe IIP India YouTube channel and subscribe other social media channels for IIP India. Thanks a lot.
Thank you, sir. Thank you, sir. Good afternoon to everyone. Myself, Dr. Monica Chandra. I'm District Coordinator for IIP Women's Health Ghaziabad. And on behalf of my team, I extend a very warm welcome to all of you. I'm also grateful to IIP and IIPWC for providing this wonderful platform where we can reach to all of you. So today we are conducting this webinar on the topic, fitness training in special population. This perhaps is one of the fastest growing segments of the personal training industry. This group basically includes people with diseases like heart disease, hypertension, diabetes, or it may be a disability such as amputation or spinal cord injury. Sometimes people are considered part of a special population due to a transient condition such as pregnancy or childhood. Dealing with a particular group of people and special fitness and exercise needs require supervision and expertise. So today for this, we have amongst us Dr. Nikky Tyagi, who is dealing with such patients and taking care of their fitness. She is our resource person for today. A very popular and talented sports physio with an experience of about 15 years. Dr. Nikky has been a part of Commonwealth Games 2010 held in New Delhi. Dr. Nikky is also a certified antenatal postnatal instructor, Lamaze instructor, and certified Mulligan therapist. Ma'am is also a lecturer at the BFI Sports and Fitness Academy, and currently she is heading Rehab Max Physiotherapy Clinic. We welcome you, ma'am. Please, everyone, anyone of you, if you have any questions, you can ask after the session and we would be answering you. Welcome, ma'am, and pleasure to have you amongst us. Please, you can proceed with your session.
Thanks a lot, everyone. And today I'm very overwhelmed because this kind of a platform is such a big platform indeed. So today I'm very thankful to all of you and to the Women's Cell, especially Dr. Monica Chandra ma'am, Dr. Priyanka, Dr. Abhivyakti, and I'm sorry if I forgot anyone, but I'm really very happy today that I've got such a nice platform today to discuss such a, what I should say, such an upcoming field, or we can say such an upcoming field in our physiotherapy world. And fitness is not about what we think that only a person who is okay or who is not having any kind of an ailment only can be fit, but the people who are having some problems or who are having different kind of ailments, they can also be fit. So we'll elaborate this one, and I'll be sharing my PowerPoint with you so we can discuss it. Yes. So today's topic is about fitness training in special population. We'll be dealing with the introduction part first. Personal trainers, or you can say not only personal trainers, now today, especially physiotherapists also, sports physios, or you can say ortho physios. I'm not specifying any branch or something. But yes, people do come to us and patients do come to us and they'll ask, we just want to be fit. How can we be fit? Or we are having diabetes, or I'm having hypertension, I'm having a back pain or a disc prolapse. So can it be a possibility for us that I can be fit like the other people who are free of any kind of an ailment? So earlier it wasn't the thing like this, because people think or many people are in that segment, then they can't be fit, or they can't be in that section where all they can exercise and they can keep their body toned and so many other things. But now the things have changed. There are so many exercises, there are so many fitness regimes which we can follow, along with the precautions which we have to take with these kind of people. So we'll be discussing it. In generally, clients with chronic conditions should follow a low to moderate intensity exercise program that progresses gradually. If anybody starts with an exercise program, see, if a normal person or a person with any kind of a disease or something, we always starts with a very low intensity, because you can't jump directly to a very high intensity and then you can do all the things, because that leads to different kind of injuries. So it is very important for us to design a proper exercise program for the people who are coming to us, whether they are having any ailment, whether they are fit, or whether they are free of diseases. Now, communication with the healthcare professional is very much important. What does that mean? If a person who is having hypertension, or if a post-CABG patient comes to us, now what is our responsibility as a physio? What I think that there is a chain actually. So, or we can say we all are interlinked or interconnected. So it is my duty to just get in communication with the cardiologist or the cardiac surgeon, so that I can take a consent from that particular doctor that yes, this person is fit for the exercises, or I can this person can comes to us and have all the exercises regime or anything. So it is very important on our part to be get in touch with the healthcare professional or the person who is from whom he is taking the treatment. Now comes the FITT principle. We all are aware, I guess. It's a very important principle which we used to follow when we used to prescribe any exercise program for a person. It is frequency, intensity, type, and time. Now let me explain you how we have to follow this principle. Frequency is like for how many days in a week we should exercise. Now, this is a very common question which people used to ask me whenever they comes to me, okay, fine, we want to join your fitness program. So what is the frequency? And whenever I say 5 days, so there's a question in their mind, why only 5 days? Why not 6 days or 7 days? So let me explain you. It is very important for us to just start with the exercise program that is like 5 days a week, because at least a day or two our body needs the time to get it into a recovery phase, because there are some micro ruptures in the soft tissues whenever we used to exercise every day. So for 1 day or 2 days, the body needs time for the recovery. So it is very important for us to just keep in mind that no, we don't have to exercise 7 days a week. If we are exercising 5 days a week, or we can say for heart patients, we'll discuss it later also. I'm just giving you an example. For heart patients or for a post-CABG patient, it's around, now the new researchers have told us that it is around 130 to 150 minutes per week, which is an act, right? Now comes to the intensity part. Yes, now which we have discussed in the previous slide also. Intensity is something that we should start with a very low intensity. For example, if a person comes to me and he said that, yes, earlier I was not performing any kind of an exercise except the activities of the daily living which I was doing. So with how much intensity I should start with the exercise program or something? Then we start with walk. Okay. Then walk is something which comes in the low intensity exercise. But if we are doing a brisk walk, then again, we move from low intensity to the moderate intensity. And if we are doing a jog or something, then from moderate to high intensity. But yes, in the starting phase, we should always start with the low intensity, right? Then comes the type. What type of exercises we should perform or we should follow? Let me explain you. There are different types of trainings like aerobic exercises. We all are aware of the aerobic exercises. Aerobic exercises is what? It is long duration and low intensity. because of this low intensity, we are able to sustain for a longer period of time. We are able to do these exercises for a longer period of time. And what they exactly do, they increase your endurance, they increase your stamina, which is very good. So whenever you are working with a CABG patient, post-CABG patient, or whenever you are working with a hypertensive patient or a diabetic patient, so always starts with aerobic exercises. Don't do any strength training or anaerobic exercises in the starting phase. Always starts with the aerobic exercises first, because they require a lot of oxygen, and when they consume a lot of oxygen, so all their muscles, they are richly supplied by the oxygen. So that is why their stamina and their endurance helps them to exercise more, or their stamina increases. So it is very good if you start with aerobic training first. Then comes the anaerobic training. Anaerobic training is what? In which it is of a very short duration, right? And these exercises in which very less amount of oxygen is used. Generally, these exercises are of short length, everybody knows. The idea that a lot of energy is released within a smaller amount of time, and your oxygen demands surpasses the oxygen supply. So whenever you are performing any anaerobic exercise, so just keep in mind that a person who is exercising in the first phase, right, in the first phase or in the starting, if somebody comes to you, so never start with the anaerobic training. Always start with anaerobic training whenever that person is acclimatized, or the body is acclimatized with the aerobic exercises. Then you can go with the anaerobic training also. Then comes the circuit training. There are different kinds of training nowadays, and so many other trainings also. Circuit training is what? It is a type of a circuit, like it is a type, or we can say there are about minimum of 4 and maximum of 10 exercises are there in a single exercise program. Now it depends on you, how you design this exercise program. For example, if an athlete comes to me, so how can I design an exercise program for an athlete? For example, the person says, okay, I'm doing a strength training earlier also, and I'm an athlete, and I just want to, build my stamina, or I just want to increase everything. My stamina, my muscle strength, my flexibility, and so many other things. So what exercises you'll include in the circuit training? For example, what I will do, I'll give 20 push-ups, then 20 squats, then sumo squats, then jumping jacks, then ropes, right? And there is no gap, and there is no or zero rest time in between these exercises. So total, what it comprises of, it comprises around 12 to 15 minutes of a single circuit, which comprises of around 4 to 10 exercises in a single circuit, right? There is no break in between. But whenever you are working with these special kind of population, do keep in mind that start circuit training very cautiously. You should be aware of the person's condition. So whenever you are going with an athlete, that is okay, or for a younger adult, that is fine. But whenever you are going with a special population, so always keep in mind that you have to be very cautious when you are working with them, right? Now comes the interval training. Interval training is again a type of a training in which there are different exercises, right? As same as the circuit training, but there's the major difference in interval training and the circuit training. In interval training, after each and every exercise, there's a gap of 10 seconds, 20 seconds, 30 seconds, that depends on you, but not more than 30 seconds. I think that's an apt time, right? So it is what you have to do. It involves all the exercises which you want to include. Again, you have to be cautious with the kind of a population which you are dealing. Now, again, we are moving to this slide. This in type we have done. Then time. How much time we should do the exercise? For example, if you are doing a high intensity exercise, or you can say high intensity exercise, you can do up to 30 minutes or 45 minutes. Okay. But if you're doing a low intensity exercise for a longer duration of time, you can increase the time. You can do it up to 60 minutes or 120 minutes, right? So again, it depends on the intensity and depends on the kind of a population which you are dealing with. So these are the basic principles, which is very important while you are designing an exercise program, right? Now, types of fitness. whenever a person comes to you, then what are the major requirement of that particular person? I want to increase my flexibility. I want to increase my muscle strength. I want to increase my stamina, which is important again. And I want to increase my balance and coordination, right? So these are the types of fitnesses, or they are the components of fitness, which is very important for us. For example, if a person says that I want to increase my stamina or endurance, we'll start with the aerobic exercises, which I do. If a person says I want to increase my muscle strength, then start with the resistance training or the weight training. Free weights are there, then hydraulics are there, right? And if a person says I want to increase my flexibility, then yoga is best for this. And again, for balance and coordination, there are balancing exercises when you're exercising on a single leg, because balancing exercises, these are very important, like when you are working or when you are exercising on a single leg, but this is a part I have seen in many, including me also at times earlier when I used to design an exercise program, that balancing is something which we used to forget. Okay, fine, no problem, we'll start with the anaerobic, aerobic and all the other flexibility. But this is also very important component, because whenever nowadays there are different types of exercises. For example, there are modified planks, there are modified squats, sumo squats, so many types of things. So you need a proper balance and coordination for these kind of exercises, right? Now comes the RPE scale. Whenever we are designing an exercise program, while I was in Commonwealth Games also, or when I was working in field, these are the very specific things which we need to follow, right? Because we can't design an exercise program without all these specifications. So what is RPE scale? RPE scale is a rate of perceived exertion. It is basically, there's a person or there's a scientist with the name of Dr. Borg, who designed this RPE scale. And there are two types of RPE scale. एक तो होता है हमारा 10-point scale. There is one 10-point scale and there is one 20-point scale. What is exactly in this scale? As you can see, the 10-point scale which we used to follow nowadays, which is now the modified version. In this, what we used to do, there is हम लोग एक scale लेते हैं, like from 0 to 10. That is subject. All the scales which we used to follow in the sports especially, they all are subjective, like it depends again from person to person. In this 0 and till 10, right? 10 is the maximum amount of exertion a person can do, and 0 is the minimum amount of an exertion a person can do. For example, I'll just give you a very quick example. 0 at rest. At rest, when you are watching TV and when you are sitting or when you are walking, are you able to performing your activities of daily living? That is fine. Then that's a 0-1, right? In first point, the exercises which we used to perform, they are very easy exercises, like a very light walk, right? Somewhat easy in 2 point, somewhat easy like chalo, see, we'll take an example of only walking or something, So in somewhat easy, like, okay, fine, I'm walking with a pace, but it is generally it is more than the grade 1. If I'm walking, so my intensity thodi si usse increase over here, right? So we'll give 2 points. Then 3 is something moderate. Moderate may we'll start brisk walk, right? We'll start the brisk walk, okay, fine. Then comes the 4th part, that is the 4 point, that is somewhat hard. In this, how I'll make these exercises, how I make only walking a difficult part or a bit complicated part, how come like somewhat hard. For example, my brisk walk bhi kar rahi hu and I'm taking weights in my hand, or I have tied weights, what athletes used to do when they are jogging or they are brisk walking, what we have seen, or when we were training them, then what they used to do, they used to tie some weights, they used to have some free weights in their hand, and then they are doing brisk walking, then they are jogging. So these are the, as we proceed from one point to the other, the intensity increases every time. 7 point, it's very hard. For example, for me, maybe if I am walking If I am somebody who is walking with weights, find it very easy. Maybe an athlete, maybe he or she finds it easy. But yes, maybe it's very difficult for me. So again, I'm telling you, it's a subjective scale. But yes, we need to follow it. It's actually, it works at times also. So we need to follow while designing the exercise program, right? Now next. Calculating the maximum heart rate, very much important, especially when we are dealing with any heart patient or post-CABG or hypertensive or patient with having a peripheral vascular disease. It is very important for us to just calculate the maximum heart rate of that person. That is very easy. Everybody knows 220 minus age we used to do. Now, let me tell you a very important point while we are doing all this. For example, if a person is having an age of 30, so what is the maximum heart rate? 220 minus 30, it's around 190 or 180, right? For example, it's 180. So what we used to do from our end, we won't ask that person or we won't train that person to that maximum heart rate. This is all which is written in books, that's fine. But when we are dealing it in a practical way, or when we are doing the practicals on when the person is exercising, then we used to ask the person just to exercise up to only the maximum heart rate, up to only the 70% of that maximum heart rate. For example, it's 180. It comes to be 180, the maximum heart rate. So what we need to do, we'll just take out the 70% of 180. That comes to be around 125 or 126. So this we have to keep in mind, that we should not increase, or we should not ask the person to exercise, or the heart rate should not increase 130, or it should be in the range of 130, not more than that. It comes to be 180, but we should not increase, or we should not go beyond that, beyond 130 or beyond 135. That is maximum, right? Now comes to the diseases. Cardiovascular disorders, they are also called as atherosclerotic heart disease. In this, there is narrowing of the arteries that supply the heart muscles and with blood and oxygen. This is caused by an inflammatory response or any injury. What are the manifestations of atherosclerosis? Includes angina, heart attack, stroke, intermittent claudication, right? Exercise and coronary artery disease. So physical inactivity is a major risk factor in all these patients. Whenever the people comes to you and when you ask about their history, or you are taking their history, you got to know that they were living a kind of a sedentary lifestyle. They were only doing their activities of daily living, but at the part where fitness is concerned, they were not doing anything much. Okay, so it is very important for you to deal with these kind of a patient cautiously, like what you have to do, what you don't have to do. Do's and don'ts are very important, right? And they should be evaluated. Again, I am telling you this thing, that while we are designing an exercise program, it is very important for us to get in touch, or we should have a proper communication with the surgeon or with the cardiologist whom the person has taken treatment for. And it is very important on our side just to discuss the points that yes, we are doing these kind of exercises with this person, or we are progressing in such a manner, or we'll be giving these this much of exercise or this much of frequency. You should discuss each and everything very elaborately, right? It is very important for personal trainers to work with. Yes, at times the people find it very appropriate. Okay, fine, I won't take a post-CABG patient, I won't take a hypertensive patient. But no, people also expect a lot from us, from personal trainers also. So it is very important to just keep an overview of all these things, and you should be aware of the patient's history also. Now comes to the exercise guideline. What are the exercises which are to be given? Intensity. This is, we are talking in particular of the diseases. Mode. Low intensity endurance exercise. Again, I'm telling you, which I told you earlier also. Low intensity exercises has to be given. for the patient of with a coronary artery disease patient. And interval type training. Again, why interval type training? Because in between the exercises, the person will get the rest, or the patient will get the rest. And yes, he'll get the appropriate or the maximum amount of oxygen his lungs requires, which is very important. Isometric exercises should be avoided in these kind of patients. Why? Because when we are doing the isometric exercises, it increases the pressure on the heart, which increases the blood pressure. So it is very important for us just to keep in mind that when any heart patient or any post-CABG hypertensive or any patient with a history of any heart disease should comes to us, isometric exercises is a big move, right? Don't give any kind of an isometric exercise. The resistance training program, you can give the resistance training, but again, with very less repetitions, right? No circuit training, interval type training you have to give. Low intensity aerobic exercises or the endurance exercise, again, the same thing. You can start with a walk, right? You can start with a walk, ask that person to walk for 30 minutes. Then again, they can do very light exercises. Interval type training you can give, right? Interval training. Intensity exercise, intensity, then again, the maximum heart rate, what is it telling? As you have seen, that हम कौन से RPE स्केल पर उसको लेंगे. अभी जो हम फॉलो करते हैं वो करते हैं 10 पॉइंट स्केल, बट इसमें इन्होंने दे रखा है 6 to 20 पॉइंट स्केल में भी लोग इसको मेजर करते थे, बट इट वाज एन अर्लियर वन, राइट? Nowadays 0 to 10 scale, or we can say 10 point scale we used to follow. It is again the same thing. उसमें बहुत ज्यादा क्या था कि आप उसको स्टार्ट कर रहे थे, but again it starts from 6, doesn't start from 0, it starts from 6. Again the same thing, it's again एक जैसा ही था, सब्जेक्टिव था. स्टार्टिंग में there's a very low intensity or very light exercises were there. Then slowly as the point increases, the intensity of the exercise also increases. So again, it's a subjective one. Again, the heart rate, you have to just take care. You should take only 40 to 50% of the maximum heart rate, which we have discussed earlier also, how we have to calculate this, right? 220 minus H, then whatever the comes, you have to just take 50% of that or 60% of that, not more than that. Okay? We have to exercise or make the person exercise within that given range. Now comes the duration. 30 minutes of more of continuous or interval training plus additional time for cool down activity. Yes. Now again, a very important part comes, that is the warm up and the cool down. Whenever we are exercising, many people start with weight training without warm up, and whenever they conclude the exercise part, I have seen people, they are just simply they are walking away. No, that should not be done. Warm up is a very important phase. We all are aware of why we should warm up, because just to avoid any injury, right, for in our muscles. So it is very important to warm up at least if you are exercising for 60 minutes. If a person is exercising for 60 minutes, then there should be a warm up of 10 minutes. It's minimum 10 minutes of warm up exercises should be there. And whenever you are cool down, at least 5 minutes of cool down, right? So it is very important. Frequency 3 to 5 days per week of aerobic training and 2 days per week of resistance training. They can start off, you can mix and match all these exercises according to you. Hypertension. Whenever the person with an hypertensive patient or any, we have discussed it, they comes to you. So what you need to do, what you need to keep in mind, that you should avoid any resistance training, much of the resistance training. If you start with very light weights, like half kg, 1 kg, but don't increase it, increase it very gradually, very slowly, right? Because what is oxygen is more and more oxygen is required by them, because they are already compromised. Their heart is already compromised. So you should take care of all these points while you are doing isometric exercises, should be avoided, right? And what are the other changes you can make? You can have some dietary, modifications, and you can some changes in the lifestyle. You can recommend them, right? Then again, the exercise guideline for the hypertension, it's almost the same as the coronary artery disease patient. Again, the mode of exercise, endurance exercise, you should start with the aerobic exercise, which is again a very important part. Aerobic exercise, you can start with brisk walk, you can start with simple walk, you can start with cycling, right? And you can start with marching at one place. If a person is not walking, the person can do marching at one place, which is again a very good kind of an exercise, because post-COVID, many patients comes to me, okay, we can't go out and we are having this problem. How can we start the exercise? How can we do it? I'm not going out for any walk or something. And marching at one place, or you can do the exercises within the home also, which is good. Isometric exercises should be avoided. Mind-body exercises is appropriate. Mind-body exercises, nowadays we are actually working on this. Mind-body exercises, they are very good form of exercises. Again, the relaxation techniques, the meditation part, the Tai Chi is very, nowadays it's very, it's very famous. People are following it from all over the world. So these are the kind of mind-body exercises. They also play a very important role nowadays, the phase which we are going through. So just keep in mind while you are incorporating the other exercises. So do keep a 5 to 10 minute session of relaxation techniques, of meditation part, which is good again. Intensity. Then again, they are following the RPE scale. They are following the 20-point RPE scale. So it's an RPE of 9 to 13. Whenever I say RPE, it's the rate of perceived exertion scale. So again, the heart rate, you should start with the lower end, like it should start with the, for example, again, it comes to be 180. तो आप उसका जो 40% होगा वहां से start करेंगे, right? और उसके 1 month बाद या 2 month बाद, when the person get acclimatized to all the exercises, then you increase the heart rate up to 65% of the heart rate which we have got, right? Not more than that. उससे ज़्यादा नहीं, because already the patient is compromised. Now the duration again, it comes to be warm up and cool down, which again is a very important part, right? But yes, while we are doing these kind of exercises, many patients comes to me which says ki when we are completing our exercise program, there is a post-exercise hypotension. They goes into hypotension. So while the person is exercising, ask them to water intake is very important part. They should take fruits, and they should take a very light snack before the exercise session, very light or something. They should keep a very light snack along with them, because in between the exercise part, I've seen many patients, they go into hypotension, especially the cardiac patients, the diabetic patients. So always keep these things in mind, that whenever that person is exercising, or any person is exercising, they should carry their water bottle. They should have an ample amount of fluid with them, or the fluid should not decrease in their body, because again that leads to hypotension. They should have some very light snack before they begin the exercise, right? These are the very small things which we should keep in mind. Frequency 4 to 7 days per week. Again, not 7 days, but yes, 4 to 5 days, maximum of 6 days. But yes, at least 1 day they should get to just so that their body is in the recovery phase during that 1 day. Peripheral vascular disease. Again, people with these kind of problems, they comes to us that we are having some problems in our limbs, because there's no proper circulation and we are having pains and all. So there is an occlusion in the circulation. So again, it is very important for us to just keep the things in mind, to have a proper history of that person, because already the patient is compromised as the flow of circulation, as the flow of blood is not proper. So while that person is exercising, endurance exercises should be done, but without weights. There should no weight bearing exercise should be incorporated, but as tolerated. But in the starting phase, just avoid all the weight trainings, all the weight exercises, any free weights, hydraulics, anything, just avoid them. Although many times the person, they told you, no, I was exercising with weights earlier also, so why can't I exercise with weights again? But no, from your part, from your side, first starts with very simple or very non-impact endurance exercise, walking, brisk walking. Okay, you can add jogging part also after some time, right? again, I'm telling you, in this fartlek training is a very nowadays, but it is very common in athletes. I forgot to mention it earlier. Fartlek training, in what we do in fartlek training, for example, if they are running, so they are running at a at the pace, okay, fine, at their particular speed. They don't decrease or increase the speed, but the surface changes. For example, if an athlete is running on a plain surface, then you just incline the surface. And this fartlek training especially takes place in mountains or in hilly areas. So there, that is the best place where the fartlek training can take place. So that is a part which I forgot earlier that comes, but that doesn't, there's no relation with the PVD patient. Don't go for fartlek training or these kind of trainings for these patients. And again, now comes to the intensity part. Moderate intensity for aerobic exercise. You can start with the moderate intensity. Then again, what it says, you can start with brisk walk. You can give jogging to that person. Low to moderate interval training you can do. But again, interval training, there should be gap after each and every exercise, which is a very important thing, right? As functional capacity improves, you can gradually increase the intensity. Again, gradually. Don't increase the intensity just after a week. At least give 15 to 20 days for a person to get acclimatized. Then you should increase the intensity from low to moderate, from moderate to high. But yes, to be onto this high intensity, or to go to a high intensity, first, there are some special, or I can say there are some special points which you should keep in mind. There are some special tests which we used to do, or I used to do in my clinics. Whenever a person is asking, now it's been long, we are working on the same intensity, why can't we increase the intensity of our exercise and all? So there are some very particular or very few points we should keep in mind. There are some tests also. It's there is a test which is called, we used to, the person has to walk or the person has to run for a particular area for a particular space, and the person has to complete that that within a specified time. For example, अगर मैं बोलती हूँ कि 1 minute में उसको इतना particular वो complete कर देना है, he has to walk half a kilometer, for example. Please give an example. Or 10 minutes में उसको half a kilometer complete कर लेना है, then that person is be eligible to go from moderate intensity to high intensity. But yes, be very cautious while you're doing all this, and you can perform all these things if a person earlier was not having a sedentary lifestyle. If a person is exercising earlier also, again, it's a very subjective thing, and it's upon us how we used to take it, how we are designing the exercise program. Are we doing the right thing or not, right? Duration, cool down and warm up, very important. Then in between, at least 30 to 40 minutes of exercise has to be there. Frequency, daily exercises is recommended, but again, 4 to 5 days maximum. Diabetics patient. While we are dealing with the diabetics patient, a very common thing which I have seen during their exercise part, they are breathing heavily at times, they are having hypotension, and they are not able to sustain a particular exercise for a longer period of time. So you need to be very cautious while these kind of people comes to you, while a diabetic patient comes to you. So whenever a diabetic patient comes to you, I always ask them to join my fitness program in the mid-morning session, not in the early morning session. In the early morning session, whenever you ask a diabetic patient to start with the exercise, 90% of the time that person goes into hypotension, right? So it is very important to just ask them, okay, fine. That person says, I gets up at 6 a.m. or 7 a.m., right? So I always ask them to exercise with me at 10:30, not before that, because I always ask them, just have a very light snack or a light meal or a breakfast, light breakfast. Just take a gap of at least 2 to 2.5 hours, and then you can exercise, right? But the snacks has to be very light. Otherwise, that many a times that ends up in hypertension, right? These are the points that we should keep in mind whenever the person comes to us with diabetes, that what need to be done. The blood glucose has to be monitored, at times. A lady was coming to me when I was there at my clinic. So she used to come to me, and she was like, her glucose level goes up to at times 300, 350. So what I was asked by her doctor that you have to measure the glucose level before starting the exercise program, and after completing her exercise, you have to again test her glucose level. So at times it becomes our major responsibility that what kind of an exercise the person is we are incorporating in the exercise regime, right? And always ask them to carry some very light snacks, like in between they are exercising, like very biscuits or chocolates, or but yes, you just can't ask them every time to just ingest a whole chocolate bar or something. They can take a very small piece, and because at times their sugar level becomes so low that it goes into hypotension. And actually, if a person with diabetes comes to us and goes into hypotension or hypoglycemia, so that's a point where you have to be very cautious. You have to just take care of all these things. And again, the fluid intake is very important. Same thing, exercise guidelines for diabetics. Again, aerobic endurance, you can start with the walk, you can start with the treadmill, but on a very low pace or a very low intensity. Then resistance training is given at times, but not much. Monitor blood glucose before and after the exercise. That is practically what I've done all this. Intensity, again, the RPE of 11 to 14. All these people who are exercising with a special population, I don't know whether you have आप लोगों ने इस चीज को notice किया नहीं किया, but all these people who are exercising with us, they are under the range of 11 to 14 only. Nobody is exceeding this range, because yes, it is not for the people with special population. They can't go beyond 14 or 15, like till 18 or 19. So athletes who are having a very good build, or who are exercising, or who are training very hard, they can go up to that point. But yes, for normal people, or for us also, or the younger adults also, they can't go beyond that. 15 to is the end point for all of them. Clients with type 1 diabetes gradually work up 30 minutes. You can start off with 30 minutes, then you can increase the intensity also slowly. You can increase the duration also. Frequency is the same, 5 to 6 days maximum. Asthma patients. Yes. Again, a very important topic. When a person with asthmatic patient comes to you, whenever an asthmatic patient comes to you and they ask, yes, I want to be fit, I want to increase my, cardiorespiratory fitness is very important for me. Yes, do. A person comes to me, she was just a 12-year-old kid, and she was having asthma, and her mother was very, she was very worried, because every time if that particular child that moves or who brisk walk bhi karti thi, so she gets panting and wheezing and coughing, shortness of breath is there. So that lady comes to me and she said she wants to be into sports and all, and that she is very much interested into all these activities. Can she do these kind of activities? Can she be able or something? So yes, that's a very challenging thing for me, but I took that case and we started. और आप जब इन लोगों के साथ work करते हो, तो you have to keep very two things in mind. You can't do any heavy exercises for the upper body, because already आपकी जो upper body होती है वो compromised है, because the cardiorespiratory functions are not that good as compared to us. So when these persons or these patients are exercising with us, so do keep in mind, always starts or always try to build the strength, their endurance with the lower body first, right? I'm not saying you don't give them exercise for the upper limb also. Upper limb also is very important part. Yes, you can start off with the breathing exercises, deep breathing exercises. They plays a major role, and they give you very good results whenever you go into deep breathing, whenever you go to segmental breathing and all. So that plays a very important role while the asthmatic patients you are working with them, right? But yes, do increase their endurance, do increase their stamina, right? With the lower limb first, and then you can move to the upper limb slowly when the with the deep breathing their their cardiorespiratory functions have increased, or their have improved a bit. Precautions, what you need to do, precautions, they should have their medications, they should have their pump all the time with them, because that's a very do and die kind of a situation at times. That's a very risky situation at times. So very important for them to carry their rescue medications, their pumps and all. And they should drink plenty of fluid during, before and after the exercise. During and after the exercise is very important. And they should avoid any asthma triggers. For example, some people, they said their asthma get triggered by the variation in the weather or by the change in the temperature. So always, whenever you are taking any history or something, always ask them that what actually triggers their asthma. Is it the weather? Is it the, at times they are not comfortable if they are exercising in the early morning. So if you are comfortable and if the person is comfortable, ask them to exercise with you during the evening time, mid-morning time, but never if they are saying that their asthma gets aggravated in the early morning time. So avoid that time, right? Reduced intensity. Again, the intensity should be reduced. It should be in a low to moderate, like it should lie in between this low to moderate range. Okay, and if something goes beyond that, if you can't handle the things, then you should have the emergency number always with you. You should have these, ask them to carry their medications, which is again very important. And yes, people with asthma often respond best to exercise in mid to late mornings, but not the early morning time. Guidelines for asthma: walking, cycling, ergometer, and swimming. Swimming is again a very important exercise for them. But yes, at times I've seen people, they are complaining me when we are swimming that we are gasping, we are having shortness of breath because of the anxiety and all. So just keep in mind, never push and pull them to some kind of exercise which again you think is right for them, or you think. So always take suggestions, always ask their priority also in what kind of an exercise they are comfortable. Because at times I've seen that if you ask them, okay, fine, you have to do swimming, and what I'm saying, you have to do it. Otherwise, it's not in my hands to increase your endurance or not. And, or you can say, you prescribe that this is the best exercise for you. So already maybe a person is having anxiety because of swimming and all, and the person is not very well versed with the swimming. And you ask that person, yes, you have to do. Already, एक तो उसको anxiety वाला issue है, and we have asked कि आपको ये करना है. So during these two things mixed together, आपका anxiety वाला factor, and already वो पहले ही उसका cardiorespiratory fitness इतना ज़्यादा नहीं है. So that creates a lot of problems. So always design an exercise program where the person who is exercising is also very much comfortable or sinks into the exercise, right? Intensity: low to moderate intensity exercises, begins easy and gradually increase intensity during the session. That again depends on you. You can start, you can give the interval training, you can give the aerobic exercises, right? There are so many variations you can give. Frequency: 3 to 5 days per week, that is apt. Now comes a very important thing: osteoporosis. What is osteoporosis? Again, we all know, when our bone mass get decreased, yeah, the calcium and the minerals, they get decreased. So we go into osteoporosis. But before that, there is osteopenia. That is the starting phase. So what need to do in these kind of a patients? Weight training and resistance training plays a very important role. So you should encourage the people who are coming to you who are having osteoporosis to go for weight trainings, right? And resistance training. And very, 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 again, very important thing, the balance and coordination exercises. should comprises of the major exercise part when you are designing the exercise program, all these balancing exercises, because what is there in the osteoporosis, when your bones get brittle and all, so there are very common chances of fractures, we all know. So uske liye hamari weight training or resistance training तो important है ही, but yes, the coordination exercises or the balancing exercises, they also plays a very major and a very important role. Intensity, duration, frequency, these all we are aware of. हम पहले भी इस चीज को भी बहुत बार डिस्कस कर चुके हैं. हमारे जो इंटेंसिटी, फ्रीक्वेंसी, ड्यूरेशन, मूड, ये सब कुछ हमारे ऊपर डिपेंड करता है हम किस तरीके से लेते हैं. एंड लेट मी टेल यू, व्हाट आई एम टेलिंग यू इज ऑल बुकिश. जो मैं आपको बता रही हूँ, ठीक है, ये चीज है, लेकिन प्रैक्टिकली जब आप एक्सरसाइज कराते हो या जब आप किसी को ट्रेन कर रहे हो, सो यू कैन सी द थिंग्स कि मैंने इस चीज को अगर इसी तरीके से लिखा है, मोड में मुझे यही लेना है, या इंटेंसिटी, चलो आई कैन से इंटेंसिटी में आई हैव टू बी इन द मॉडरेट इंटेंसिटी और आई हैव टू बी इन अ लो इंटेंसिटी फेज. So it is not always applicable. You can see there is a vast change or a drastic change when a person is exercise, again because of that depends on person to person. Again, it's very subjective. So aap jab is cheez ko practically karte ho, so it's more of a practical rather than what is written in the books. So you just follow your instincts, you just follow the things which you have read, follow the FITT principle, see what the patient is feeling, see how much improvement is there in that particular person's fitness. Then you can increase all the things accordingly, or which points you need to decrease, you can do it by yourself. Again, arthritic patients also comes to us with osteoarthritis or the rheumatoid arthritis. So it is very common, and many times females used to come to us and they say, "Ke nahi, we used to exercise, but we are having knee pains, we are having back pains." So we all are aware. I think this is the most common problems which we used to face, or which we used to see. Now people are, the females, they have become very और I would say कि वो भी अपनी बॉडी को लेकर बहुत अवेयर हो गए हैं. they just want to be fit, they want into fitness, so they ask क्योंकि हमारी ये problems, again it depends on the history taking, and then you can prescribe the exercises. Again, you can add on. Actually, that is made a major difference if a person comes to a physiotherapist these days and ask for the fitness training, or if a person goes to a trainer. See, I'm not against anyone. I'm not saying that yes, the people who are in the gym, they are not giving a good fitness training or something. But yes, there's a plus point with us as a physios, that yes, we know the detail of a particular disease, that how much exercise should be given, or if a person is having an arthritic knee, so we need to incorporate the quadricep exercises, we need to incorporate some of the knee exercises, again with the exercise regime which we have already built or which we have already done. So we need to incorporate some few other exercises, so that uska jo knee wala issue hai, knee wala jo part hai, wo bhi aapka side by side resolve ho jaye. So it's very important. Exercise guidelines for osteoporosis, again weight training is a very important part. Then other parts are, you should increase the intensity slowly, gradually, but not suddenly. Cycling, you can ask them to go for a brisk walk, you can ask them to go for a jog, you can start with the interval training. So and resistance training, weight trainings, free weights, hydraulics, there are ample of exercises nowadays. So you can incorporate these kind of exercises, whichever you think that is right for the particular person, and depends on the age also. At times when an older adult or a person when above the age of 50 or above the age of 40 comes to us, so you need to be very cautious while you are giving the exercises, or while you are incorporating some new exercises, right? Balancing, very important, which we need to take care of. Low back pain, again the same thing. Whenever a person comes with a low back So we need to incorporate the exercises. If a person is having a lateral shift or a PIVD is there, lateral shifting is there. So what are the exercises which we always used to prescribe? Is all the extension exercises. There are so many exercises along with the extension exercises. All different variations are there. You can go with planks, you can go with core stabilizing exercises. So these are the best exercises. You can ask them to go for a back walk, which again is a very good exercise because it helps in increasing the strength of all the core muscles, especially the multifidus. So these are the kind of exercises which you can do if a person comes with a low back pain. Again, a history plays a very important part, whether contraindicated exercises are the extension ones or the flexion ones. So you need to take care of them. Again, forward flexion is, you won't ask the person, basically it's an ergonomic part, very small. You don't ask the person to bend much, or you don't ask the person that while you are lifting anything. So these are the activities of daily living, or the variations in the activities of the daily living, which you can incorporate that while you are working or while you are sitting or while you are doing work from home. So what are the variations, how the furniture should be designed. So you can, not only you can tell the exercise part, but the other things also which are related to us, which we can ask the person to change or change in the lifestyle. We can always incorporate them. Never feel shy. Okay, see, this is not my part, or this is a very small part of mine. Why should I tell? No. In totality, how much you can help that particular person, you should. Older adults, while you are dealing with older adults, again, I've told you, the people who are above 40, right? So what need to be done, there are some specific exercises. For example, modified planks. Agar aap modified planks ek younger adult ke sath aap start kar rahe ho, you can always do that. But while these modified planks you are doing with older adults, then you need to be very cautious. First, start with the plank exercise. This is just an example I've given you, because in modified planks, what you need to do at times during the exercise, you will be on one hand only and the other hand touches the shoulder, right? This is the alternate one. So during these type of exercises, balancing again and flexibility plays a major role. So while the person is not a well-versed person, or the person is not, while you're not doing much of the flexibility one or much of the these balancing exercises, so never go for the modified versions, right? For youth, you can go with all kind of exercises. You can go with all kinds of experiments, but yes, again, very cautious with them also. You can incorporate some very playful activities with them, right? As for the older adults, I remember whenever 3 people, they were coming to me, 3 ladies, 3 females, they all are above the age of 55. Very enthusiastic ladies, and they want to, they want to be fed, they want to do these different kinds of exercises. But again, they were having a knee problem, one is having a back problem. Now they all want to do the exercise or the fitness training at the same time. Now it becomes a very difficult thing for me exactly कि कैसे इनका exercise program में design करूं. So I incorporate some very playful activities, and there are some chair exercises which are very good for them. Then there are some gym ball exercises, but yes, gym ball exercises you have to be cautious, because इसमें balancing और आपका coordination plays a very important role. So again comes, it depends on, it's a very subjective thing. It depends on person to person. Maybe a person of an age of 20 can come to leading a very sedentary life earlier, not able to perform even a single exercise. So आपको किस तरीके से स्टार्ट करना है, आपको किस तरीके से एक्सरसाइज को, इन कौन सी एक्सरसाइज को ओमिट करना है, कौन सी एक्सरसाइज को ऐड करना है, it all depends on you. It all totally depends on you, and definitely the person also, how much he or she is comfortable, right? But yes, some playful activities, some games also, some you can start with some recreational sports with them. For youth, you can ask them, if person is playing badminton or something, then yes, you should encourage it. Yes, you can incorporate some other exercises also, which are of higher intensity. exercise now a very important and a very near and dear topic of mine, that exercise recommendation for pregnancy. Normally all the people who comes to us, they are the postnatal period, but nowadays the trend has changed a bit. I've seen many antenatal females who are during their pregnancy, they used to come to us, but again they are very वो लोग बहुत ही डरे हुए रहते हैं चीजों को कि while we are doing exercises, because earlier what the people used to think that during the pregnancy all that's big no to all the exercises, but now the things have changed. We have seen the articles also, you know, the people, the females who are exercising during the pregnancy, we have seen a very good results after. Even they can avoid their cesarean section also. And what it's a very vast topic, but we will discuss it in a single slide. What need to be done when these people or when these females, they comes to us? Do not begin with a vigorous exercise program shortly before or during the pregnancy. There are different exercises during the first trimester, during the second trimester, and the third trimester. I'll tell you in brief. Second trimester is the safest trimester and we can exercise, right? First trimester, you can start off with very light exercises, but yes, there are some exercises which need to be avoided during the first trimester. They are the sumo squats, right? They are the pile squats. These are the kind of exercises which we used to avoid during the first trimester. The second trimester is the safest one. You can do the bridging exercises. There are modified bridges like bridging with SLR and different types of other with variations also. And in the third trimester, again, there are some flexibility exercises, there are some yoga poses, then there are breathing exercises. How can you forget them? Breathing exercises from first trimester to the last trimester. Breathing plays a very important role. Lamaze breathing is all about different types of breathing during the different phases of your pregnancy, during the first trimester, the second trimester, and the third trimester. Again, this is a very vast topic, but these are the small tidbits or small points which we need to keep in mind. Never ask them to exercise when it's very hot outside. Or, okay, fine, if the person is exercising within the AC or something, then it's fine. But never ask them if the climate is very humid or something, because they go into hypertension. Never ask them to stand at a single place and exercises for a longer duration. Always ask them to move from one place to another, because they need to shift their position. अगर आप एक ही position पे खड़े रहकर exercise करते रहते हो, so again there is a fall in the BP, and you'll end up in a mess or something. So proper food intake is very important. Then again, they should have a light snack. They should wear very loose clothes and all. They should wear supportive shoes and undergarments, which is very important. That shoes plays a very important part, because again, because of the shift of the COG, the balance and the coordination is a bit disturbed. So you need to keep in mind while you are incorporating some balancing or these kind of coordination exercises. So be with them all the time. Be very cautious while they are doing these kind of exercises. So it's all about what I can say. And very important thing, always ask the gynecologist if they are taking treatment form or the obstetrician. Yes, you should obtain a consent form from them. You should have that consent form with you in your records, which is very important, because at times the people, they come to you who has asked you that you should work with the NDA, these kind of females. So you should have that consent form always with you, right? And you should be in a regular touch with the gynecologist so that you can know the condition of the person. For example, whenever there's a case of a placenta previa, or when the placenta is a lower side, never you should incorporate very light exercises. इस केस में हम बहुत ही minor, बहुत ही tidbits, बहुत ही light exercises देते हैं, because anytime the bleeding starts and the person ends up in a critical situation. So these are the kind of things which you are dealing with. आप जब इन लोगों के साथ deal करते हो, तो धीरे-धीरे when you are doing all these exercises, तो आपको अपने experience के साथ plus आपका practical knowledge के साथ आपको सब कुछ अपने आप पता चलता जाता है कि how we have to deal with these kind of people and patients and these kind of population. So guys, thanks a lot. That's all for today, and I think maybe हम लोगों ने कुछ ऐसा share किया जिससे शायद मुझे भी present करके या कुछ ऐसा, and if there is any query or something, we can discuss it. You have my mail ID, you have my number. Anytime you feel like anything you want to talk to me, और हम लोग कुछ discuss कर सकते हैं, मुझे कुछ नया सीखने को मिल सकता है आपसे. I'll be very happy, and everything, like all the questions are welcome from my side. And thanks a lot.
Do we have any questions?
Ma'am, YouTube पे तो questions नहीं हैं. I think we should wait for the chat box.
Have my mail ID, have my number. Anytime you feel like anything you want to talk to me or हम लोग discuss कर सकते हैं. मुझे कुछ नया सीखने को मिल सकता है आपसे. I'll be very
I guess there are no questions.
like all the questions are.
Thank you so much, Dr. Nikky Tyagi ma'am, for the excellent and informative session. Thanks for taking out time for this webinar. I would also like to thank all participants for gracing the webinar with your presence. I extend my sincere gratitude to Dr. Sanjeev Sir, our IAP President, Dr. Ruchi ma'am, IAP Women's Health National Head, and Dr. Nikky ma'am, our North Zonal Head, for providing this platform so that we can reach to all of you. Thank you, State team, for always being so supportive. Thank you, our technical team, Dr. Vinod Kaushik sir today, for the support. We request you all to kindly like, share, and subscribe our IAP channel, YouTube channel, and also IAP Facebook page. Thank you. Let's stay united for our profession. Thank you.
Thank you so much all. Thank you, Dr. Priyanka. Thank you, Dr. Monica. Thank you, Dr. Nikky Tyagi ma'am, for a wonderful session.
Thanks a lot, everyone, for this wonderful webinar, IAP Gajia branch. Yeah, it's a really nice webinar today you have organized.
Yes.
And again, in the last, I show my gratitude to our Dr. Sanjeev Keja and Dr. Ruchi Vasta ma'am. And I just request everyone, please subscribe IAP India YouTube channel and other social platforms. Thanks a lot.